Hello, my name is Joanne Wiles and I'm a Senior Community Nurse with the School Nursing Service. This webinar is about talking to your child about puberty, about healthy relationships and keeping clean. The School Nursing Service consists of qualified nurses who have had additional training in child health and wellbeing. They work in teams with other staff nurses, nurse nurses, support workers and admin staff. The school nursing team supports children and young people from reception right up until they reach their 19th birthday. We also support young people who have disabilities or additional needs, and they can access our support until they are 25 years old. We offer advice, support, and we can help with a range of physical and many mental health problems. We operate a single point of access, and we are available Monday to Friday, 9 till 5, all year round. You can call us on 01922 423349, and parents and carers can text us on 07520 634 909. We offer confidential advice and support, and our text messaging service is anonymous. So what is puberty? Puberty is when a child's body begins to develop and change as they become an adult. And obviously it's something we've all got to go through, isn't it? But what does puberty education actually cover? It's more than just the body changes. It covers emotions, personal safety, living a healthy lifestyle, personal hygiene, and healthy relationships. It can be a little bit awkward sometimes for parents to feel that they've got to talk to their child about puberty. It's one of those little chats that some parents actually dread. But it's important that you have that little chat. It's reassuring your child that the changes that are happening are normal and everybody has to go through them. And obviously as an adult, you've already gone through it. So it's reassuring your child that you understand their worries, their concerns, and you know how it actually feels. It will help your child to understand their emotions as well. As they're going through puberty, emotions will change, and it's important that they understand this. It will help to prepare them for the changes that are going to happen, what to expect, and when to expect it. It will help them to make important decisions about their bodies, healthy decisions, and it helps them to understand how to care for their body as it changes. When does puberty usually start? The average age for girls is 11 and the average age for boys is 12. However, every child's different and your child may start as early as 8 years old or as late as 14 years old. If this happens, it's perfectly normal and it's nothing to worry about. But it's important that you reassure your child that everybody is different and it's perfectly normal. If your child does start developing and going through puberty before the age of 8 or after 14 years of old, you still haven't noticed any changes, then it may be worth visiting your GP just to check out that there's no underlying cause or any reason for this. So we're now going to look at the different changes that happen to boys and girls. So let's think about girls first. With girls, one of the first things that happen is that underarm, leg, and genital hair will start to grow. Okay, genital hair is usually one of the first, and that's something that they may have noticed. Their breasts may start to develop and bud. Okay, with girls, it can be a little bit uncomfortable when this is happening. It can be a little bit painful for them. It's just growing pains. Okay, some girls their breasts develop at different rates as well. And one breast may bud a lot quicker than the other. So they may look a little bit different in size for a while. Obviously, the main thing is that children go through a growth spurt as well when they're going through puberty. So this may be the first thing that you notice. Periods will start. I will talk about periods a little bit more later on because it's usually one of the later signs of puberty. Hips will broaden. Obviously, a girl's body is going to change as she's going through puberty. So it's important that they understand this. And many girls will put weight on as well, due to the different changes that's happening. So again, it's important that she understands that this is down to puberty. It's not because she's overeating, and she certainly doesn't need to go on a diet. Some girls may develop greasy hair and may develop acne. This is due to a hormone that's released from the brain when a girl starts going through puberty, which causes the body to produce more oils. So when it's released onto the head, obviously it can make the hair more greasy. When it's released onto the face, it can make the face more greasy, and that can cause acne. So it's really important as they're going through puberty that they understand how important it is to wash this grease away. So they may find that they need to wash their hair more often, and they may find that they need to wash their face more often to wash the oils away. It's really important they get into a good hygiene routine at this stage. There will be many emotional changes as well that your daughter will go through. And again, your child may be up 1 minute and totally fine, and then may feel a little bit down and tearful at other times. Again, this is perfectly normal, but she should be prepared for it. You may also find that your child starts to sweat more. And obviously when they're sweating more, if this sweat again isn't washed away, it can cause smells, BO. So again, it's important that they get into that routine of good hygiene. So especially if you've started to notice that there may be a little bit more odour. So some of the first signs of puberty in girls will be that breast development. Okay, and as I say, this can happen to different breasts. It may hurt a little bit, so it's important that they understand exactly what's happening. When they do start to develop the breasts, it is important that you go and get them sorted out with their first bra. Okay, they may need to go to a department store and be measured for a first bra, or you can use the training bras that you can buy, which may be perfectly adequate depending on the rate at which her breasts are developing. Pubic hair will also start to grow. This is one of the first signs, as I said earlier. So it may be something that she's noticed in the bath. Again, it's really important that you reassure her it's perfectly normal. Some girls may also notice a lot more hair on their hair and on their hair on their legs and their arms. And many girls get some hair on their upper lip as well. Okay, some may appear on their backs. Again, it's really important that your daughter understands that this is perfectly normal. Yeah, and try and encourage her not to try and shave it off at this stage. Yeah, as she's starting to go through puberty, she is still developing. So try and reassure her that it's okay. Later signs of puberty in girls will be that underarm hair starts to grow. And as I say, other girls may get hair on other parts of their body, such as their top lip. Okay, some girls may get that earlier as well. As you can see by the pictures there, that's the development of the underarm hair. And usually by the age of 19, that's the underarm hair is fully developed. One of the later signs of puberty in girls is also their periods. And girls usually have a first period around the age of 12 years old. A period is when the ovaries release an egg. And obviously, if the body doesn't need that egg, it's released very naturally through the vagina. When this happens, usually blood is released as well. Okay, and this is just the lining of the womb coming away because it's not needed. This can be a little bit scary for girls, can't it? And it's reassuring for them that it only happens once a month for about 3 to 8 days. Okay, it's really important that a girl is prepared for periods, because if she's on her own when she suddenly notices blood in her pants, it can be a little bit scary. So again, it's really important that you talk to her about what's going to happen, especially when you start to see the first signs of puberty. And it's important she knows it's going to happen, as I say, once a month, probably up to around the age of 50 years old. She may experience other symptoms when she's having a period, such as pain, stomach pains, headaches, and tiredness as well. So again, she needs to be told what these may be. So we're now going to go on to the changes with boys. penis and testicles will start to grow. Okay, so this might not be very obvious because it will be slowly. Okay, but as well as the penis and testicles growing, the child will have a growth spurt as well. And in boys, that's usually the first thing you notice. Their sleeves of their jumpers are getting very short very quickly. They seem to be growing out of the trousers quite quickly as well. So it's really important that they understand this is totally normal, and that could be one of the first signs. Their muscles will start to develop as well. And again, this will cause their body shape to change. So it's important they're aware that their body shape will change. Again, they may put on weight. So just reassuring them that that's absolutely fine. Again, the same with girls, there will be increased sweating. And this can be under their arms, it can be the feet, it can be all over the body really. But it's important when you first start to notice the changes that your child gets into that good routine of washing every day. Yeah, nice, good hygiene habits. The voice will start to change, and this is due to the voice box changing. Obviously, this can be a little bit scary for a boy when his voice starts to change. 1 minute he can be talking with quite a high pitched voice, and then his voice will start to lower, and this can go up and down for quite a while before it actually flattens out to what it's going to be. Again, it's perfectly normal. Just be aware that your child may have a bit of teasing by other lads while it's happening, but as long as they know that it's just puberty, it's going to happen to everybody. Their shoulders will broaden. Again, this is that body shape changing, so it's important that they understand. And again, with hair, they're going to get facial and chest hair. Obviously, when they start to get the facial hair, you can start to talk to them about shaving. Yeah, really important that when they do decide that they want to start shaving, that they're shown how to do it correctly. So please show them how to do it in a safe way, not using razors, but using a shaver, and only to do it under supervision to begin with. The chest hair as well, and the underarm, leg and genital hair will also start to grow, as you can see. So it's important that they understand there will be hair growing in different areas of their body. On a man, it can be also on their back, on their back of their arms, all over really. So it's important that they understand that. And as it says there, the emotional changes as well. Again, just the same as with boys. Boys go through emotional changes with puberty. So it's being aware that, again, they may be perfectly fine one day, 1 minute, and the next they're very tearful and they don't understand. It is just puberty. Some of the first signs of puberty in boys are usually their testicles getting bigger and the scrotum begins to thin and redden. Pubic hair will also start to appear at the base of the penis, and they will start to sweat more. You might notice that BO smell a little bit more. So really do try and encourage them to have that good hygiene routine. The later signs of puberty will be the facial hair and that voice breaking. And as I say, it might be quite high 1 minute and then quite low the next. It's also important, too far. It's also important that boys are aware of wet dreams at this stage as well, which is something that may happen. And that's when the penis ejaculates while the boy is asleep. Okay, it may cause a damp patch on their sheets, and it can be quite embarrassing for them. Okay, but again, it's perfectly normal. It's something that's going to happen. So just reassure them that if it does happen, they can put the sheets in the washing machine, or they can come and just let you know that the bed might need changing. But it's not going to hurt. It is perfectly normal. When we do these sort of sessions with children, we do an activity called What's in the Bag. And what we do is we talk to them about different things that they may actually find useful when they're going through puberty. These are things that they may need to start to use more, or things that they may need to start using which they've never used before. As you can see, hopefully they would use the toothbrush and the toothpaste quite regularly. That's not going to change, but just talk to them about the importance, maybe as you're going through the hygiene routine and maybe changing that slightly, the importance of brushing their teeth. As you can see, there's liquid soaps there, bars of soap. Talk to them about how important it is to have that daily bath or shower, to wash away those oils, to wash away that sweat that is they're going to be seeing more of as they go through puberty. Brush and comb, obviously, again, it's just that good hygiene routine, keeping themselves looking nice. Yeah, you may notice as they're going through puberty, they do start to take more of pride in their appearance. So they may start to want more of these sort of things where that they can use to help them with that. And we've got aerosols there. It's important that you talk to them about the importance of aerosols, deodorants, what they're for, and when it's appropriate to use them. Especially in school, I know that schools don't like children taking aerosols in, especially even if they've had PE. They'd rather they take a roll-on, and this is due to other children in the class that may have asthma. So it's being aware of that. So if your child does say that they want to take, I know that girls like body sprays, don't they? So just encourage them to take a roll-on into school. Leave the body spray at home. Okay, and obviously there you can see sanitary towels as well. As I said, it's one of the later stages of puberty for girls, the periods, but it's important that they know what's going to happen, and it's important that they're prepared as well. If you notice that your daughter is starting to have maybe a discharge on her pants or a thickening of the discharge that she may already have on her pants, that can be a sign that periods are about to start. So that may be the time to talk to her about it. If you are noticing that she's starting to develop and you think periods aren't far away, then it's really important she's prepared, because if it does happen at school and she's not prepared, it can be a little bit embarrassing for her. So make sure she's got a sanitary towel, make sure she knows what they look like, how to put them in her pants, how to use them, and very importantly, how to dispose of them. I know that in schools, they do have sanitary towels. They have a supply in school. So no girl will ever be left without one. You know, she can approach teachers. But some girls are as shy as we know about approaching teachers and letting them know that they've started their period. So get her to be prepared. Maybe give her an extra pencil case that you can keep a couple of pads in there so that she's ready. Maybe a clean pair of pants as well. So as you can see, lots of items here that your child might start to take an interest in. Maybe get them a little bag and start to put some things in so that they know this is what I need to start using. If you can get them into the good routine now, brilliant. It's something that will stay with them for life. We've already talked about these emotional changes in puberty that might happen. You might find that your child has mood swings. Like I say, 1 minute they're absolutely fine, and then next they're shouting at you and you don't understand why. May get very angry, 0 to 10. Yeah, perfectly normal. Feeling oversensitive. You may be talking to them about something that's never really bothered them before, and then it starts to really upset them. Feeling differently about their friends or other people, you know, members of the opposite sex even. So they may have always had a boy as their best friend. This is for girls, obviously. A boy is their best friend and it's been fine. But then all of a sudden their feelings start to change. They might feel that's not appropriate anymore. Or they may have always had girls as their best friends and all of a sudden they're starting to take an interest in boys. So again, this is all down to their emotions and it's perfectly normal. So when your child gets a little bit older, it's important that you start to talk to them about healthy relationships, about what constitutes a healthy relationship. So you can talk to your child about the importance of trust, honesty, respect, why these are really important in relationships, and what characteristics aren't so important. You may find that their relationship with you or their siblings or other members of the family will start to change. With teachers as well, they may become closer to some teachers, or they may start having arguments with their teachers. They may feel a bit that they're telling them what to do. Again, it may be the same with yourself. They might be telling you, they may feel that you're telling them what to do and they don't want it anymore. They've got a mind of their own. Yeah. But they might start to find, you might start to find that their relationship with you changes because you're arguing more, or it may make your relationship better. It's important that you talk to them about the qualities in relationships. It's about quality rather than quantity. I mean, I know myself, for young people, it's really important how many friends they've got on Facebook. Okay. But are they really friends? It's important to realise what an actual relationship, an actual friendship consists of, that quality. And being aware of those characteristics of a good relationship, being open, respectful, having that good communication between you. Yeah. You want to make sure that they understand what also constitutes a bad relationship. If they've got a friend who is constantly buying them presents and asking them to do things they don't really want to do, is that a good relationship? Yeah. So it's important that you talk about that. At this stage, it's also important that you talk to your child about personal safety. Okay. Really important that as they go older, to pay attention to those issues which may make them more vulnerable. Stranger danger. Okay. When they're younger, when they're toddlers, we talk to them about stranger danger, don't we? Not talking to strangers, not taking sweets off strangers, not going home with someone from school that they don't know. It seems when they go through puberty, that's all gone out the window and they've forgotten everything that you talked to them about. And again, stranger danger comes back into its own really as they get older, because there are more opportunities for them to meet strangers. They're starting to be a little bit more independent. So yeah, as you can see, that lots of online and social media platforms here where stranger danger is really important. Okay, they can be groomed online. It's so easy for children to be influenced and groomed. So it's important that they understand what can happen. Younger children obviously need to be supervised. They always need to have the company of parents when they're chatting online. Obviously, as a child gets older, they're not going to want you around to watch what their every move. So just talk to them about the importance of keeping themselves safe. When children are younger, they did have that Safe Pants in it SPCC campaign. Maybe it's just worth reminding them about the aspect of that. That is online, you can access it. So just talk to them about, I mean, I think the main thing about the Safe Pants campaign is what's under your pants is private, okay? And to keep it private and to be respectful of that. So yeah, just talk to them about that again as they're going through puberty, because like I say, their body's changing and they will start to feel differently about their body. And that environmental safety, about being aware that as they're getting older, when they're going through puberty, probably they're going to be on their own a lot more, walking to school when they're on their own, when you probably walked them to school before, going out with their friends, and when you're not around, when you're not with them. So again, just being aware of the dangers, crossing the road, maybe teach them the Green Cross Code again. Lots of children like to have their ear pods in, don't they, when they're walking along or when they're having a run or going for a walk with their friends. Again, just being aware of what's around you, who's watching you. So yeah, puberty is a really important time to just stress those important messages again. You can get further support and information from your school, from your GP practice, especially if you are concerned about your child. Yeah, if you are concerned that they're going through puberty earlier than is expected or later than is expected, then it might just be worth visiting your GP just to check out that there's no underlying concerns. Obviously, the school nursing service, that's us. We have, as you can see, websites there, Health for Kids and Health for Teens. Those are websites where you can access everything that the school nursing service has to offer. They are national websites, but if you go on and there is a drop-down box and you put Walsall in, it will come up with what's available in the Walsall area. And all the school nursing service information is on there. Obviously, Childline is a really good national organisation. And for further information about puberty, always visit a reputable website such as NHS UK. There are also some websites there, Kids Health and Parent Zone, which will give you a little bit more help with talking about puberty to your child if you want a little bit more help and advice. Okay. Obviously, if you're listening to this as a webinar, you can't ask any questions. So thank you for listening. But if you do have any further questions, what I would encourage you to do is to ring our duty line, and that's 01922 423349. That will give you access to a school nurse. The number was on the beginning of the PowerPoint as well. So hopefully you won't have any questions. That's answered everything for you and given you lots of ideas of how to approach talking to your child about puberty. Thank you for listening.